Yeah, so Nemtabrutinib is a non-covalent inhibitor of BTK, and it's actually a very unselective inhibitor, so it's pretty much a pan-TEC and pan-SRC kinase inhibitor. So that means it actually has a lot of targets outside of BTK that are potentially important in CLL. We tested this in a phase 1 dose escalation study with an expansion cohort and presented on patients who had received the 65 milligram once daily dose, which is the recommended phase 2 dose. So 57 total patients with CLL or SLL. They have done very well. Overall response rate's about 56%. We do see that actually increase with longer follow-up, just like we see with most BTK inhibitors. And median progression-free survival is 26 months right now, so looking very good. Because it is so non-selective, it has a little bit more toxicity than what we see with the more selective BTK inhibitors. Primarily things like dysgeusia, fatigue, some cytopenias. Most of the BTK inhibitor-associated toxicities that we really worry about, things like hemorrhage, AFib, those do not seem like they're coming up in high numbers of patients. We have about 5% of patients with atrial fibrillation at this time. We do have a relatively high number of patients with hypertension. Both of those toxicities, though, I think it's a little bit unclear whether there's any contribution of prior therapies, because almost all patients had gotten ibrutinib before.